First, we have the urinary UB22, which is located 1.5 June lateral to the posterior midline on the level of the lower border of the spinous process of the first lumbar vertebra, or L1. This is the Back-shu point of the triple wormer, the function of which is to distribute heat and fluid evenly between the three warmers. When there is coldness all over, or when there is stagnation of dampness in one or all three warmers, this would be an ideal point to use. Placing caps after needling would be an additionally beneficial in the case of dampness. Next point is UB23, which is located 1.5 June lateral to the posterior midline on the level of the lower border of the spinous process of the second lumbar vertebra, or L2. One of the most used Back-shu points as the shu point of the kidney. It is an important point for tonifying kidney yang to improve the urination and reproductive function. It is also used to treat cold feet, night urination, low sperm count, low libido, and yin-type backache. Between the two UB23 points is another important point for infertility, point Du4, called gateway to life, or Mingmen. Next is UB24, which is located 1.5 June lateral to the posterior midline on the level of the lower border of the spinous process of the third lumbar vertebra, L3. Not a Back-shu point of an organ, this is called qihaishu, or the Back-shu of the sea of energy. The qihai point, trend 6, is found below the navel and is used to draw from the stored energy around the umbilical cord after birth. Next point is UB25, which is located 1.5 June lateral to the posterior midline on the level of the lower border of the spinous process of the fourth lumbar vertebra, L4. This is the Back-shu point of the large intestine. This is a good point for improving LI function, especially when it is lazy or does not absorb well. Next point is UB27, which is located 1.5 June lateral to the posterior midline on the level of the first sacral foramen, the Back-shu point of the small intestine. It is used again to improve the movement and function of absorption. If patients complain of distension in the navel region and below with undigested light-colored stool following a meal, this would be the best point to use, perhaps together with moxa on point trend 4, the front move point of the small intestine.